Welcome to my presentation on emphysema. The objectives of this presentation are to explain what emphysema is. I will describe symptoms of emphysema, identify causes of emphysema, describe diagnostic processes, as well as treatment options. What is emphysema? Emphysema is a disease that falls under the category of COPD, or chronic obstructive pulmonary disease. These diseases are a group of lung diseases that make it difficult to breathe due to damage to the air sacs within the lungs. Emphysema specifically makes it hard to catch your breath and is progressive in nature. Our lungs are important respiratory organs found within the chest cavity, with one lobe located on each side. The main function of the lungs is to receive oxygen from inhaled air and transfer it into the bloodstream. Upon exhaling, the lungs push out the carbon dioxide from the bloodstream, a process known as gas exchange. Air enters the body through the mouth or nose and travels through the trachea. The trachea then splits into two bronchi, one for each lung. These bronchi branch off into progressively smaller bronchi, referred to as tertiary bronchi, and again branches off into smaller bronchioles. At the end of these passageways lie the alveoli. These small air sacs are where the gas exchange process takes place. Emphysema is a chronic disease caused by inflammation and progressive inability of alveoli to expand and contract when you breathe. As in this picture, the alveoli are bunched together at the end of these bronchioles. With emphysema, the inner walls of the air sacs become damaged due to factors which we will cover later in this presentation. As the alveoli weaken, they eventually rupture, creating one larger airspace instead of many small ones. This structural breakdown causes less surface area for oxygen to enter the bloodstream. As the alveoli's functions diminish, they cannot exhale carbon dioxide properly and takes up space within the air sacs. This lessens the ability for oxygen to enter, leading to the symptoms of emphysema. Individuals can have emphysema for years before they notice symptoms, as they are gradual in nature. Symptoms start by a shortness of breath, which eventually interferes with one's level of activity, so the tolerance for exercise decreases greatly over time. Coughing and wheezing that does not go away or is not caused by a cold is typically present and can indicate the disease. Over time, the level of mental alertness suffers. Also, another symptom that emphysema presents is a bluish tint to the lips or fingernails due to poor circulation and low oxygen levels within the bloodstream. What are the causes of emphysema? By far, the leading cause is from smoking cigarettes. Studies show that individuals who smoke are 6 times more likely to develop emphysema than non-smokers. Cigarette smoke damages the cells within the airway, whose job it is to clear mucus and other secretions. The airways are lined with tiny hairs called cilia. Prolonged smoking causes these hairs to disappear from the cells lining the airways. Without these cilia, mucus cannot be cleared and leads to mucus buildup, which then leads to infections and inflammation. Over time, the chemicals found in the cigarette smoke decrease the elasticity of the alveoli and eventually destroy these air sacs. Air pollution is another factor shown to increase the likelihood of getting emphysema. Those who live or work by factories or chemical plants with poor air circulation are at the most risk. Airway reactivity dysfunction syndrome, or ARDS, is a form of irritant-induced asthma, which can also lead to symptoms of emphysema. Hereditary factors, age, and the male sex are also at higher risk for the disease. However, smoking is still the leader of emphysema cases, but is also the most preventable. The image shown here illustrates the extent of damage that cigarette smoking does to otherwise healthy lung tissue. Aside from the undesired symptoms of the disease, there are also complications that can come about. A condition known as a pneumothorax occurs when a lung collapses due to an abnormal pocket of trapped air between the lung and the chest wall. The air pushes on the outside of your lung, making it collapse. Another complication that can arise is called a cor pulmonale, or right-sided heart failure. In this case, the right ventricle stretches due to elevated blood pressure within the arteries of the lungs. Giant bullae, or air pockets, can grow and take up space within the chest cavity, limiting the area for the lungs to capture air due to crowding. There are diagnostic procedures that a physician can perform when suffering from symptoms of emphysema. After asking a patient about their lifestyle habits, a physician will take an X-ray to help rule out any other causes for the symptoms, such as bronchitis or asthma. Next, a CT scan may be performed, which gives a detailed view of the tissues within the lung. A test called a pulmonary function test, or PFT, can gauge how the lungs are functioning with a device called a spirometer. A spirometer can measure the volume of air that your lungs can move, therefore measuring ventilation. This procedure is often repeated during treatment to assess the effects of medication. Also, a blood test called an arterial blood gases analysis is used to measure the transfer rate of oxygen to the bloodstream, as well as the removal of carbon dioxide from the bloodstream. Emphysema is a progressive disease that has no cure, but there are treatment options available to slow the process and better the quality of life through its progression. The most important step for many is to quit smoking cigarettes. To lessen the cigarette smoke that enters the lungs will increase the amount of oxygen that enters your bloodstream. Medicated inhalers and aerosol sprays that contain corticosteroid drugs can reduce inflammation as well as relax constricted airways and help relieve shortness of breath. Antibiotics are prescribed only in times of infection, like pneumonia or bronchitis. Pulmonary rehabilitation techniques can teach breathing exercises that may help with shortness of breath or even return the ability to exercise comfortably. In cases where lung tissue is extensively damaged, with no other treatments offering relief, one can have a lung volume reduction done to prolong the quality of life. The surgery consists of the removal of 20 to 35% of damaged tissue in one or both lungs to increase space within the chest cavity. The space created allows the remaining lung tissue, intercostal muscles, and diaphragm to expand more easily, making breathing and the quality of life better. In regards to the most advanced stages of emphysema, where most of the lung tissue is damaged, a lung transplant can be performed. Once a physician decides that a patient is a candidate for a transplant, the patient is then referred to the regional transplant center, where a host of tests take place. If and when a compatible donor's lung becomes available, the physicians must examine the donor lung before the surgery process starts. The risks involved range from infection to organ rejection, as well as complications from the surgery. However, a lung transplant is a last option to prolong life as much as possible and has no guarantees. The best position to be in when it comes to lung health is to be able to prevent diseases like emphysema from occurring. Lung tissue is delicate and vital to a properly functioning body. Be conscious of how you treat your lungs. Never start the habit of cigarette smoking, and if you already have, now is the time to quit. For more information, go to the American Lung Association site listed here to learn of more ways to prevent emphysema.